Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice. Hey everybody, Chad Madden here with the Grow Your Practice podcast. And today we have an awesome episode. We actually have two guests that I've worked with side by side here in the same building in Harrisburg, Pennsylvania at Madden Gilbert PT. First guest is Brenna Strawser. Got the pronunciation right?
Strawser, close enough.
Okay, I thought I had it. All right, I was practicing. Brenna's a DPT here at our Harrisburg office, LVC graduate, and we're going to be talking with her specifically about, she does an amazing job getting Google reviews. I think you had 11 last month, Brenna.
Yeah, I think you're right. Double digits.
Yeah. So crushing it there. And I know you at least had one other double digit month this year. So exactly what you're doing. And also Christian Grove, also DPT, also Lebanon Valley graduate. And I think you've been here for 9 or 10 years, Christian.
Yep, you got it.
Cool. And Christian, what is your title here? Clinical excellence?
Yeah, so Director of Clinical Education, I guess is what it's formally changed to. So really excited about that role.
Cool. So just to set the context here for everybody, as a practice owner, we're constantly balancing two things. One is production, that's business math. So if you're an owner and you're listening to this, you're likely looking at, the productivity of your clinicians in terms of visits, or maybe you look at gross billings or something like that. We do something similar where we have a range, red, yellow, green, but realize there's a business math component of how we view that. Most owners only think of that. The other end is relationships, and we're constantly balancing those two things, business math and relationships. And the way that we measure relationships in our clinics is we look at graduation rate. A therapist who's providing high quality of care for us likely has a very high graduation rate. And we noticed that most of our clinicians within our company that are green, so that means they have high production, they keep their schedule full, and they do compliant billing, and they have high graduation rate. Most of them were trained by or somehow connected to Christian. Right. And so we have a checklist, and one of those things on the checklist is collecting testimonials and Google reviews. So a few weeks ago, we were in a staff meeting, and I heard, it's probably 2 months ago now, and I heard that Brenna had 10 Google reviews in a month. And I asked you about your process, Brenna. So talk us through, why are you motivated to get Google reviews, what it's done for you in your career, and then we're going to ask you how you do it as well.
Yeah, for sure. So my process of getting Google reviews, well, first of all, the motivation for it is kind of funny. We have a competition in the clinic every month. Whoever gets the most Google reviews gets free lunch the next month. So I'm a pretty competitive person. I know it's good for the company as a whole. I like to see what my patients have to say about their experience afterwards. But the main issue I think that people have with getting Google reviews is they just don't ask for them. I've been to tons of companies and just never really thought about leaving a review afterwards, even if I've had great service. So step one, you just have to have the confidence to ask for a Google review. So the way I go about that, we have a sheet that has 2 different QR codes on it. One will take you right to our Google page where they can leave a review. The other one takes you to the website. So I just say to patients, like when I'm going through my discharge process, I'll say, hey, last but not least, we always ask at the end of a discharge if you'd be willing to leave us a review. I have a sheet here. If you have your phone, go ahead and pull it out. If they have their phone, I have them scan the QR code right away. I ask them if they have a Gmail account. If they don't, they just scan the website QR code. And then I will literally stand right beside them, make sure that they have Wi-Fi, because sometimes it can be a little spotty in our clinic. And I basically just hold their hand through it and walk them through it. I always say, thank you. We really appreciate it. I tell them about the competition. So there's a little bit of a guilt trip in there, and patients are always really excited to help you out. And, oh, yeah, we'll make sure you get that free lunch. And if they have any technical difficulties, I've even gone as far as taking their phone and walking over to an area in the clinic that I know has good service and basically just doing it for them. I've even typed out a Google review. Somebody just told me what they wanted to say, and I typed it out for them. So it's pretty simple. It takes like 5 minutes, but I think it's pretty effective.
Nice. So just to recognize a couple things. One, the QR code that drives to our website. We did get that from eRehab, right?
I believe so. Yeah.
Yeah. So David Straight, eRehab. I think they gave us those QR codes. The other thing is I would love to hear exactly what you say when you slightly guilt trip somebody about the free lunch. Like how are you saying what you're
So I go into it, I say, the reviews really help us get new patients. The more reviews people see online, the more likely they're going to come in here and see us so we can help other people get the help they need. And then I go into, and I'll let you in on a little secret here. So there's a competition in the clinic. Whichever team gets the most Google reviews at the end of each month gets free lunch. So if you want to help Sarah and I, Sarah's my PTA, if you want to help Sarah and I get a free lunch next month, go ahead and leave that review. And my tech, Taylor, is leaving in a couple weeks, so I've really been guilting them. We're really trying to get Taylor her free lunch before she goes back to college. And people have really responded to that. They're getting Taylor her free lunch this month.
That's awesome. And I haven't looked at the total number of Google reviews in a while, but I think this office has a couple hundred Google reviews.
I think we're well over 500 at this point.
Yeah. Very cool. Awesome job, Brenna.
Yeah, thank you.
Yeah, thanks for sharing that. And so, Christian, in the checklist, as you're thinking through, and I know you're, I just talked with Dan, the clinical director, about this, but how efficient you are with the use of your time in the clinic and then helping other clinicians do the same thing. Getting Google reviews and patient testimonials on somebody's graduation day is one of the items on our checklist. What else? How else do you think about? I know when I met with the group here in Harrisburg about the green and 100% graduation rate checklist, one of the things that we looked at was like future pacing. So every single visit, we're talking about, hey, next time you come in, this is what we're going to work on. Last year, you trained Alicia. I think this Q1 of this year, she had 3 months in a row of 100% graduation rate off the top of my head. And I think she did it 2 more months. So 5 of the first 6 months of the year, she had 100% graduation rate. She worked with you directly for a year. I believe you trained Noah, and now you're training Brady as well. Can you talk about, like, for a young DPT, how you think about helping them develop the skills so that their schedule stays full, they stay productive, yet at the same time they're providing that high quality of care and making sure people graduate?
Sure, yeah. Well, I mean, I guess one thing to start with is I think most new grads are in the mindset of following academic research or articles or things like that. So I knew when I first started out, I wanted to find some things to support me and support that rationale, I guess. And so I did some digging, and one book that I stumbled upon was called WAN by Dan Pink. And in that book, he cites a study. It was a medical study by Dan Kahneman. And it's basically a study looking at colonoscopies. And in that study, he's looking at the ideas of endings and whether or not endings impact our memory of something. And so, I pulled that study and actually read it because I was curious how that might impact, my patient's experience for endings. Because, every eval, you could stick the landing, you could do the perfect hands-on care, right? A lot of our therapists do a lot of manual therapy. So you could do the perfect intervention. Patient's pain could drop from an 8 down to a 3. And yet if you go through exercises, you take them up front to schedule, and maybe something fumbles or something doesn't go smoothly, the thing that's going to actually stick out in their memory of that entire thing is the ending. And so I kind of took that and thought, okay, well, what other endings happen within my plan of care? And it's, I mean, the second visit, the third visit, the fourth visit, every single visit matters. It even, not even between visits, but if you're transitioning between, okay, this is your time with the patient, and then maybe you're going to switch over to a PTA or a tech or something like that, that could in some ways be taken as an ending. So all those things really matter. So back to with students and new grads especially, I actually print that article out. I make them read it. I give it to them and say, hey, check this out. And they hold it and think, okay, wow, this is a pretty fancy looking article. Let me read it. And then I just kind of break it down and tell them something along those lines. And they see what I do, and then they start to say, oh, yeah, that makes sense. I'm going to start to try that too. So in the clinic, something that might look like, or what that might look like is, hey, Sally, that was great what we worked on today. You did an awesome job with that really hard balance exercise we did. We'll work on more of that next time. So just following up the session or following up that portion of the visit with something that was a win for them, I think is really important. And then it builds on the positivity for the patient. So
awesome. And the paper you're referring to is Memories of Colonoscopy, a randomized trial, published in the Pain Journal. And I have the link. So for people that are watching this, I'll throw that in the show notes. If you're listening to it, you can find Memories of Colonoscopy. Just Google that, and I think the article comes up. Right.
Yeah. So another thing another study that I include in that, and this is maybe like, week 1, week 2, week 3, something like that, for either when they're a student with me or just a new grad that I didn't have as a student. There's another study. This is more of a PT study by Mark Baston, and that was in 2017 that he published it. It's a really short article. It's like 2 pages. But the idea of that article is he looks at predictors of successful graduation for patients. And the biggest thing he pulls from that is getting to PT, showing up. So I think he looked at, like, if you hit, out of a 12 visit plan of care, if you hit 10 out of 12, your likelihood of graduation was like a 65%. And if you can bump that up to 11 out of 12, it jumps to like 91% likelihood of graduating. So when I read that, I realized, wow, okay, me just getting people to show up really can have a big impact on my care. So how can I get patients to keep showing up? How can I keep them on my schedule? How can I make sure that they fulfill their plan of care that we agree upon early on? So that's something that I'll share with, new grad students again, and we talk about that, and then we kind of break that down, what makes sense to them and how they can implement that right away.
Nice. We'll also share the link for that one. That's called Association Among Select Clinical Data and Successful Completion of a Treatment Plan in an Outpatient Orthopedic Physical Therapy Setting. Happy to include that. Great. So what were some of the interventions, keeping those 2 things in mind, the happy ending, for lack of a better term, at the end of a colonoscopy, and then also going from 10 to 11 visits of the 12 and increasing graduation rate? It sounds like it was 26% bump in graduation rate there. What were some of the things that you started incorporating in your own schedule to improve those 2 areas?
Well, I think scheduling patients as the PT really makes a big impact. We have a lot of pull when you're the one who's working with the patient each session or, week to week. And at first I would always just kind of pass that off to another team member. And I realized that it wasn't always happening the way that the schedule wasn't building up the way that I thought it would or should. And so I realized, well, okay, if I take a little more ownership of this and either train or teach my tech or PTA or whoever is my support staff at the time how I want that to look, or me just doing it myself. I know it's one extra step, but an ounce of prevention is a pound of cure. It helps to prevent having triples and doubles throughout your schedule. It helps to keep your schedule, we have 40-minute blocks. So I like to get one every 40 because I know I can maximize that billing. I know that I can maximize my care with the patient. I know that they're going to get better quality of care if I do it that way. versus, when I started, I had, 2 or 3 patients at a time, and then I'd have a gap. And then I'd have another 2 or 3 patients, and then I'd have a gap. And it just drove me crazy. I'd get behind on notes. And so I realized that would be a win-win-win for everybody to try to solve that problem. So I call that preventive, I forget what we call it, but scheduling in advance, basically. So we'll even take a patient and say, hey, for next month, I'm going to go ahead and put these visits in for you right now. You can take a look at it. I'll print it out. If there's anything that doesn't work for you, just let me know and I'll change it.
Proactive scheduling.
Proactive, maybe that's it. Yeah, Dan coined that word, so I just do it. I don't really have a fancy terminology, so thanks.
Nice. So question for both of you. Another factor that came up was empathy and adaptability. And I think there were 2 big things that I heard. The first was something that Ava had shared about, like, if a patient's right brain or left brain and how they think about progress with their plan of care adjusting. So I'd be interested in how you both apply that. And the other thing that I forget who said it, but and I think multiple clinicians said it, was the willingness to revamp the program if somebody's having a rough day. So Brenna, we'll start with you. How do you implement those 2 things in terms of empathy and adaptability? How are you doing that on the fly with patients as they're going through and adjusting to where they're at?
You can learn pretty quickly if a patient is more right brain or left brain. Basically, if they're more a numbers kind of person or like a quality description kind of person. So if they're a numbers person, I usually go in whenever I'm working with them. After I've done my manuals, I go in with the goniometer and I measure whatever range of motion is limited. And then I can show them, like, hey, you've gained 4 more degrees of your shoulder flexion today than you did last time. And that really resonates with people who think more in quantities, because they can see that progress, versus people who are more qualitative. They tend to prefer, like, hey, that exercise is looking a lot better. Your form's looking really good. I really like that you're not compensating. It's more of those words of affirmation for them, I think. So it's kind of adapting to how they respond to their progress. And then the second part, what was the second question?
Revamp.
Right brain, left brain, or what was it?
Revamp.
Revamping. Yeah, that's right. So sometimes patients come in, they're having a bad day. They feel like they're hitting a plateau. Usually when the word plateau is thrown around, the word revamp gets thrown around. So I'll say to them, like, hey, let's take a closer look at your exercises. Let's see what's working, what's not working. And let's just try a couple new things today. Maybe I'll say, let's hold on these exercises. You've been doing them a while. Let's try a couple new things. And we'll do that for a week or 2. If you're seeing progress, great. If you're not, you feel like you're still at that plateau, then we'll revamp again. We'll look at things again and maybe reassess as needed.
Love it. Thanks, Brenna.
Yeah.
Anything to add there, Christian?
There's a book called The 4 Tendencies by Gretchen Rubin. I read that a couple years ago, and it's just a description of a framework of categorizing different people and personalities. I think the DISC is maybe another one. There's a bunch of them out there, but which she tries to lay out as 4 different categories of people. You're either a rebel, you're an upholder, you're an obliger, or you're a questioner. And so I usually try to just quickly put a patient into one of those categories, and that helps me to just quickly figure out how I need to communicate with them. Because, being a PT, all of our skills are important, but communication is probably the most important. So the quicker you can get to the patient, communicate with them on their level, the better you're going to help them reach their goals. The more likely they're, like, all of those things trickle down if you can do that well. So that kind of lines up with what Brenna, you just said there with right brain, left brain. If they want to have the numbers, great. That's how you're going to have to talk to them. If they want to talk about their grandkids and why their leg needs to be stronger to do that, great. That's the way you have to talk to them. So that book, I think, was really helpful for me, and I would definitely pass that on to anybody else who's looking to get some structure for that. I think
Nice.
That's it.
Yeah, very rare somebody throws out a book out that I haven't heard, but yeah,
I'm 2 for 2 now.
I know. Throw me off. That's great. Um, the end on a high note, future pacing. Okay, have a lot there. I'll ask a personal question or two. Brenna, you did work in another setting other than here, and I think
Mhm.
for our listeners, most of them would assume that you've been practicing for 20 or 30 years, right? And you're fairly recently out of school.
Yeah, 2 years out.
2 years out.
Hmm.
Can you talk about a little bit about some of the other settings that you worked in, and then what you've created here, the similarities or differences in what you've been able to do?
Yeah, so my now fiance and he's also a physical therapist. We tried our hand at travel PT, went out to the middle of Washington State into a pretty poor part of the state, lower socioeconomic class. We both worked in nursing homes. Learned pretty quickly that that was not the setting for me. I have a lot of respect for people who do enjoy those types of settings. But it was definitely a different experience for us, especially where we were at. We were working with some lower status patients, a lot of kind of traumatic injuries, just general deconditioning, people that basically had nowhere else to go except for these facilities. So there was definitely kind of a lower, more somber mood in that setting. Working with those people, you had to be pretty lighthearted. You were treated as a mental therapist as much as you were a physical therapist. So taking those experiences and coming into outpatient where people are more likely to be a little more mobile, a little more cheerful, I think it's helped me deal with people who are having a bad day and just slowing things down, talking about like, hey, what's really going on here? And like I said earlier, revamping things and just turning the mood around, basically.
Awesome. Christian, you've been in the same room for 9 or 10 years now. But we'll switch it up for you. So you've had the opportunity to mentor quite a few students over the years. Do you know how many total students you've worked with or entry level DPTs?
It's been a few, but not off the top of my head. Yeah, maybe
Yeah,
like 10.
yeah, that was the number that I had in mind.
Yeah.
Cool. So obviously there's a bell curve, right, of learning and willingness and everything. What are some of the characteristics that you've seen in? And by the way, I think your bell curve is probably skewed to the upper end significantly. I think you've had really good young DPTs coming through working with you. What are some of the things that you look for as a mentor in terms of somebody who's going to take your advice, take your structure, be willing to implement, and really like make it their own and make a good career as a physical therapist? What do you look for?
Um, well, I would say it's like people who are willing to go above and beyond. I think usually you can tell that pretty quickly. So um, each week with a student, I give homework, if you will, but try to make it relevant. So hey, we had that really tough case with that shoulder patient. I know you really haven't had many like that. Is there anything you think would help you next week? Anything you'd want to research this weekend that might help you with that? And so it kind of turn it over to them. It resonates with adult learning theory, so it gives them control of their own problem solving. But those who do it are the ones that usually do well. Those who don't are the ones that usually struggle more. And it's not as much about the actual reading as much about the process of I'm willing to go above and beyond and figure this problem out. So because that translates to everything. If you're able to problem solve, you can work through just about anything.
Yeah. What was the adult learning thing that you said?
Um, Adult learning theory.
Yeah. Is that like mastery, autonomy, purpose? Not to do another Daniel Pink reference, but
I'm not as familiar with that. It definitely could be.
yeah.
Um,
Essentially it's agency, right? It's initiative to go out and reach?
Yeah, so like self-directed learning, experiencing for learning, that's really important. Making it problem-centered instead of like, I'm going to tell you this fact and you have to remember it. It's like, okay, here is a person who's coming in tomorrow. They're dealing with a ACL problem. So we're going to learn about an ACL because we have a patient tomorrow who has that, right? So it's focused on the problem. So that type of thing, yeah. If you just like Google adult learning theory, you can find there's like 5 or 6 criteria that they talk about, and it would summarize it a lot better than what I just did.
Awesome. So typically at this point, before I ask you the final question, for each of you, we usually do a handoff to, if somebody wants to learn more about you or what you're doing, what's the easiest way for them to find you? And so you can share Instagram, Facebook, Twitter, if you or X, whatever it's called right now, if somebody wants to learn more about what you're doing with Google reviews, Brenna, what's the best way for them to do that?
Probably just emailing me directly at brenna.strawser@maddenandgilbertpt.com. I'm not really on social media.
By the time this comes out, will your last name be changed?
No.
Okay. All right. Got it. I wanted to know if you were going to change your email is the main thing, but got it.
Nah.
We'll put that in the show notes. And then Christian, same question for you.
I just old school email would be probably preferred. So christian.grove@maddenandgilbertpt.com.
Cool. So final question, most influential book that you've ever read in your life? Brenna, you're up first.
That's a really good question. Honestly, The Richest Man in Babylon was really influential for me. I know that kind of comes indirectly from you, because that was referred to me by Dan. And that totally changed the way that I viewed money. I was pretty financially illiterate before then, and I think that was a really good starter book for me to, grow my wealth. And I'm in a pretty good place now financially, so that was definitely the first stepping stone.
Nice. Yay. Just gave that to my oldest son. Great. Same question. Yeah.
I would say The Intelligent Investor, and just the margin of safety alone, I think, not just from the perspective of investing, but margin of safety for just about everything I do, I think is a principle that just is really important. So The Intelligent Investor.
Love it. Both of you, thank you so much for doing this and hopping on here. This was great.
Yeah. Thanks for having us.
Yeah, it was a pleasure. Thanks again.